The first element involved in preventing pressure ulcers is turning. Turning and repositioning in their beds or chairs is necessary to prevent pressure ulcers. The constant pressure against certain areas of the skin reduces the blood supply to that area. The affected tissue can eventually develop into a pressure ulcer. By turning a resident, you shift the body points that are under pressure and increase the blood flow to affected areas. Healthy people constantly shift their weight and body position when sitting in a chair or even while sleeping. This constant shifting prevents tissue damage. Residents with temporary or permanent limited mobility, however, oftentimes cannot independently shift their weight when sitting in a chair or lying in bed. This decreased mobility increases residents' risk of developing pressure ulcers. Residents with temporary or permanent limited mobility require members of staff to help them reposition themselves when lying in bed or sitting in a chair or wheelchair. Residents who are bedridden or immobile should be repositioned at least every 1 to 2 hours in bed and hourly when in a chair or wheelchair. Some residents require more frequent repositioning. You should always refer to a resident's care plan to determine his or her repositioning schedule. Residents who are able to move independently should be shown how to correctly reposition themselves. While sitting in a chair, these residents should shift their weight approximately every 15 minutes. Be certain to remind residents to shift their position as often as indicated in their care plan. Residents who may be less alert or who may have memory loss may require more frequent reminders. There are certain techniques that you should follow to correctly and safely reposition residents. First, always protect residents' skin from injury. When repositioning a resident, avoid causing friction between the resident's body and his or her bed sheets or chair. Improperly pulling or repositioning a resident may cause skin tears or lead to pressure ulcers. A lift sheet or draw sheet can be used to safely move or lift residents. A lift sheet or draw sheet is placed under the resident in bed and helps staff members to easily move or lift the resident without pulling or tugging on the resident's skin. The head of the bed should not be elevated more than 30 degrees unless contraindicated by medical condition. Next, check for any possible pressure points and never allow skin-to-skin contact. You may add pillows to help prevent pressure. For example, place a pillow between a resident's knees to take pressure off the skin. If a resident is seated in a wheelchair, be certain it is properly fitted with pads or cushions. Finally, check a resident's care plan for individual repositioning needs and any assistive devices that may be required. If a resident has a high risk of developing pressure ulcers, be certain to float the resident's heels, or a heel lift boot may be used to ensure that the heel does not touch the bed. Remember, residents' heels are one of the most common parts of the body to develop pressure ulcers. A special pressure-relieving mattress may also be necessary for those residents who have a higher risk of developing pressure ulcers.
Okay, ready for a quick quiz question? Just listen to the question and select the right answer.
At a minimum, how often should you reposition bedridden or immobile residents? A. Every 10 to 15 minutes. B. Every 1 to 2 hours. C. Every 4 to 6 hours. D. Every 12 hours.